Hey guys, welcome to our Friday Facebook Live. I'm Dr. Jennifer Greer. I'm a plastic surgeon in Cleveland, Ohio, if you haven't met me yet. And I'm excited to be here with you guys. I seriously look forward to talking to you every Friday. I get really excited when we have live viewers, and I love that people go and check it out later. So the videos are always available on our Facebook page, but then my awesome assistant Rachel, shout out to you girl, also uploads them to our YouTube channel. So if you want to go back and see all of the videos in one place, just go and look for Jennifer Greer MD on YouTube and you'll see our whole channel. It may be Greer Plastic Surgery, I can't remember, but it shows up pretty easily. So you can see a backlog of all the videos I've done, not just the Facebook Lives. All right, so today we have a question from a viewer, which I'm so excited about. I love getting questions and getting to answer them, which honestly, education is a really big part of being a doctor. And it's fun to explain things to people in ways they can understand. So our first question comes from somebody who's really interested in tummy tuck and liposuction, but has about 30 pounds left to lose. And her question is whether she needs to lose the weight before surgery or not. So this is a little bit in-depth of an answer. The first thing to know is what are the things that keep your stomach from being flat. And I've actually got a great blog post on this. Rachel, if you can tag to that, that would be awesome. I'll send you the link. And it's basically explains the 4 reasons your stomach can't be flat or isn't flat. So one is extra fat under the skin. The second is extra skin in and of itself, which is really common after pregnancy or weight loss. Then you can also have space between your muscles. So your 2 six-pack muscles, they're like this, right? And they spread apart with pregnancy and they don't always heal back together. So that's called a rectus diastasis. It just means a widening of the rectus muscles. And that can make your stomach kind of puff out. And then you can have intra-abdominal fat too. That's the fat that's inside around your internal organs, also called visceral fat. So whether or not you need to lose that 30 pounds first kind of depends on what is causing your stomach to not be flat. If you really just have a lot of loose skin, then no, you probably don't need to lose the weight first. If you have a significant amount of fat inside the abdomen, then it's going to make a big difference in your results if you lose the weight first. The general advice I give to patients is if you have, 10 or 15 pounds to lose, it's usually not a big deal. More than that, when you start getting into the 20 and 30 pound range, the risk is that if you have surgery and then lose weight, you may have some extra loose skin or your abdominal muscles might not be as tight as they could be. Here's what I would recommend though. Go see a plastic surgeon, somebody who's board certified and a member of the American Society of Plastic Surgeons. That way you know they're qualified, and see what that person thinks, because everybody's built differently. And depending on your body composition, he or she may recommend losing weight before surgery, or you may be fine to proceed. Some people just have a lot of extra skin and weight loss isn't going to make a big difference there. So even losing half the weight you plan to lose before surgery could help. It's definitely not too soon to see a surgeon and get some more specific information though. All right, so the other topic I wanted to talk about today is thread lifts. And this is a call we get a lot, people asking if I do thread lifts. So let me explain what a thread lift is. It's basically a resorbable suture. That means it's going to dissolve. And the idea is it's put in under the skin to lift the muscles of the face. So theoretically, this sounds pretty awesome. That's essentially what a facelift does, but without the whole lifting up the skin. The problem is you're basically doing it blindly. You're trying to sneak that thing in under the skin, grab bites of what you need to grab, and get it lifted. And it's hard to do that reliably. It's also at risk of catching weird things. Like basically you can have weird motions when you animate your face or weird tugs and pulls because you're putting this stitch in blindly and you may be catching other tissue that you don't want. The other issue with thread lifts is that they don't last very long. They tend to wear off, unlike a traditional facelift, which does not wear off. With a traditional facelift, you look 5 or 10 years younger and then you continue to age naturally. So it's not like your face magically descends at midnight and you turn back into a pumpkin, which kind of does happen with thread lifts. So I've actually never done thread lifts or offered them. I do a very traditional facelift. The skin is elevated over the cheek and then the neck for the neck lift portion and the muscle layer is tightened. But the difference between a true facelift and a thread lift is I can see the muscle, I can see exactly where I'm putting the stitches, I can see exactly the result, and then I'm also removing the extra skin. So I don't recommend thread lifts. I do recommend seeing a plastic surgeon who does a lot of facelifts if you're interested in that. And I love hearing more viewer questions, so please log on next week. You'll see our little infographic asking for questions. Just put them in the comments under there, or you can always message me. And I look forward to seeing you next week. Have a great weekend.